So a lot of patients will ask, what is TMD? What is temporomandibular joint dysfunction? What temporomandibular joint dysfunction is a series of symptoms the patients will feel, such as pain in the ear, pain in the joint, clicking, popping, pain in the biting muscles, which is the cheek muscles, which we call the masseter muscle, muscles on the side of the head, which is the temporalis muscle. I'm going to anecdotally say that 90% of the temporomandibular joint dysfunction that we treat has to do with patient's poor bite. And that's really not just the alignment of the teeth, but how the jaws are coming together. And mostly what happens is as they bite, the jaw joint will move back and up, putting pressure against the ear. That's when the patient clicks. We'll ask the patient to open. As they open their mouth, the jaw would deviate to one side or the other. Usually the side that the joint or the jaw moves toward is the side of greater pain. So TMD is really this, what we call a smorgasbord of symptoms and signs. And treatment is mostly designed to alleviate those symptoms. So many of our patients are referred by an ENT, ear, nose, and throat specialist. And they would have gone to their ENT first because they're complaining of either fullness of the ear. I feel like I'm in an airplane and I can't pop my ear. Or they might feel like, that feeling of being underwater. They're complaining of clicking and popping, which is causing ear pain. They may have vertigo, which is dizziness. They may have tinnitus, which is a ringing of the ears. And a good examination by an ENT will eliminate the fact that they don't have an ear infection. They don't have any ear problems per se that needs to be treated by the ENT. Therefore, the ENT will say this must be a temporomandibular joint disorder. Sometimes we get patients referred by a neurologist because the patient has headaches, either migraines or tension headaches. And again, if they're in the face of the lack of any pathology, anything that needs to be treated by the neurologist, they'll send them to me. And our objective for treatment is to relieve symptoms, make the patient feel better. And in my practice, in the scope of treatment that I provide, it's mostly done with oral appliance therapy. And I can tell you quite clearly that with the use of oral appliance therapy, patients get a tremendous amount of relief.